Friday को program है ना sir?
Yeah, but Thursday, by the time I reach, if I'm traveling, I don't know.
No, I will give you everything ना sir. उतना क्या है? उतना
Thank
तो
you.
बनता है ना
Sure,
आपके।
sure. But fantastic. I should appreciate you for this thoughtful process where you have involved so many aesthetic specialists. And
कृष्णकुमार सर उद्या आपण 4ला निघायचंय ना ते 7ला पोहोचायचंय कारण मी लॅपटॉप घेऊन निघणार आहे
हाँ, मग ठीक है.
मी पण
समीर
पुन्हा
है
चाललोय
तो
बहिणीकडे राहायला आहे या कोर्स साठी लवकर चाललोय
very nice. Samir है तो he will teach us more also with all clear explanation.
समीर अपन अभी नीचे बैठा तो सबका माइनोरोप्लास्टी करने वाला है। स्केल का स्केल
प्लेबे मायनोप्लास्टी विथ हिस्टेक्टोमी
so
He's already started the vaginal society. Now he will start vaginal aesthetic society separate.
तो हम उसको अभी प्लास्टिक प्लास्टिक प्रधान बोलने वाले हैं।
No, really wonderful 2 days which I have been, and of course today I think one of my student is going to talk for the first one.
Oh.
Yes, sir.
Yeah,
Yes,
she's
sir. Good
there.
evening.
Good evening. So I've joined to hear you.
So sweet. Thank you, sir. But I think unfortunately you won't be able to see me. Hopefully you
Fine.
can see my slides. There's some issue with my video sharing. So
Okay.
because we have to start on time, I'll at least give my presentation. But
Oh.
really good to see you, sir. Thank you for joining.
But everybody would have been happy to see you.
Thank you, sir.
So she is shown in the group, no?
Sir, can we start?
Yeah. So now you can see. Yeah, Dr. Rashna, I think first talk. I would request our chairpersons, our coordinators to start today's session. It's already 8
Yes,
o'clock. We'll start in time.
yes, sir. So I would like to welcome Dr. Rachna Kaveri, ma'am. She is our speaker, the first speaker for today, and she's going to speak on HIFU. And ma'am is already a director at her clinics in the famous location Powai. She's also a consultant in 700 Hospitals, Mumbai, Nirali A.M. Nayak Charitable Hospital, and even in Mahalakshmi Hospital. She's also had many awards and achievements. Welcome you, Doctor. Welcome, Dr. Rashmana, ma'am. You can just start with the presentation.
Thank you. Thank you for the kind introduction. So I'll just directly jump at my presentation. I just want to thank Dr. Kiran sir for having me here, Dr. Parul for coordinating and being such a sweetheart. It's a great honor. It's a absolute august audience, and I'm just humbled, grateful to be here in front of so many of my seniors and all my colleagues. So thank you so much. So, without any ado, let me start with my talk because I want to cover a little bit of it. My talk is about HIFU, innovative technologies, and her. I think throughout the course, we are going to be discussing about a lot of different technology that we'll be using to enhance what we offer to our patients in terms of her gynecological health. And HIFU for me has been a very helpful modality. So, when Dr. Parul asked me, I jumped right at it and I said, I want to speak about HIFU because that's what I am using in my practice. So I think I would do justice to this topic. Now, let's just quickly talk about why are we interested in cosmetic gynecology. So many people, extremely busy consultants on a weekday. Why are we talking about all of this? Is it because of the glamour and novelty? Well, I don't think so much because I think in our residency days and all these hours that we've put in, the glamour and novelty is all gone out of the window. Is it because of the money? Maybe a little bit, but I don't think that's the most important reason. What I definitely think is an important reason is that our approach towards the women's well-being or what we offer to our patients in terms of our quality of life has improved and enhanced. What we want to offer to our patients is a good quality of life, and we no longer have patients who are sick. In fact, I think mostly gynecologists do agree that most of our patients are just healthy women and they're not really sick. They are in different phases of their life, and we want to offer whatever is best for her phase at that point of time. Now, Google defines quality of life as the standard of health and comfort and happiness experienced by an individual. Dr. David Matlock says our mission is to empower women with knowledge, choice, and alternatives. So here we are as cosmetic gynecologists trying to do just that. Cosmetic gynecology is basically, as we know, the fastest growing. Yes, sir.
I think your slides are not moving. We can
Uh,
biodata currently.
Oh, I'm
You
sorry.
can go on the slide share. Yeah. You can go on the slide screen. Yeah.
Sir, can you see it now?
No, we can see the slide, but it
But
is
make it full screen.
full screen. Please.
Yes,
it-
I have actually done
No,
that,
no.
sir.
No, it is not full screen. Your slides are seen on the side and you can see. You go to that marker which is there on the lower corner of the right side. Once
Yes,
you get
sir.
the cup.
Sir, Krishna Kumar, sir, I'm already actually in my laptop on the slide sharing itself.
Doctor, there is, I mean, if you see up, there is actually slideshow. So you can just click onto that. It will come onto a show in the
Yeah.
presentation.
Okay, let me
Do
start.
it from
Is it working?
No,
I'm
no,
moving my slides on the slide sharing.
No,
no,
you
no,
share
no.
from beginning. You just put from beginning. Yeah. No. So now this it is stop sharing. Yeah. Now you can share again.
Yes, sir.
Yeah, after sharing the slide, you have to start the slide show.
Yes, sir.
Yeah.
Now we have only the
So can you see now? Any other slide?
Can
You
just
can
see
see
your
your biodata slide.
CV.
That's all.
Oh, no, unfortunately, I am moving it, but it's not
No,
going
no.
ahead.
You close it. You first open up your slide full show and minimize it and then put it in that share. What you did initially was first, right? But then only the slide was not showing in the normal pattern.
So can you see anything now?
No,
No.
no.
We can't see anything.
Did you open your slide full presentation?
Yes, sir.
Now minimize it.
Okay.
And then come to that share which is seen in the main screen on the green arrow.
The
Share
Zoom.
button. Zoom ka platform mein, that is the share green button. Click that.
Yes, sir.
Then it will show your slide which is there, slide presentation which is there. Click on that.
Rachna, your screen is not being shared only actually
Yeah,
as of
that's
now.
what you share your screen. Now it's
Yeah, now
coming.
it has started happening.
Now can you see? Okay.
Now can you let it be there? Now can you see the main slide which
Yes,
is seen in main one?
I
Sir,
Just
think
can
this
you
is
below
see
that.
now?
under. Okay.
Can you see it now?
It's
Yeah,
about
we can see.
fibroids and increased sense of self and inner something. I mean, that's what we can read on the screen.
Can you see
Fibroids stop growing and increased sense of self and inner
No,
strength.
we can see the slide. What we were telling you is go to the slide show on the screen. When can you see up
Yes, sir.
slide show?
But
Yeah, there you
Krishna,
click.
this is the wrong presentation. This is menopause presentation that you
Oh,
are.
this is
Yeah.
menopause you have started. Surgical
So
menopause.
actually, in my screen, unfortunately, I am on the HIFU one.
No.
No. Right now, that means you shared. There are two slide presentation open. You close this menopause from your in your laptop.
Okay. I'll just shut it.
Kiran sir, if with your due permission, can we take the next presentation first? Meanwhile, she is trying to resolve this.
I
I
have
think
no
that will save time for the delegates.
Or we can ask her to share it with one of you and you can share it, no?
No. By the time she shares it, it will be time now. The whole slideshow has to come to
I
you.
think we'll do one thing. We'll ask Renuka ma'am, the next speaker, to take it from here, and then once Rachna is resolved, we can have her presentation.
I will talk to Rachna in the meantime and tell her what is to be done.
Yeah.
Thank you so much,
Yeah.
sir. Otherwise, I'll coordinate with her. Reshma ma'am, can you please introduce our next speaker?
Yes, madam. Okay. Just because of the technical hitch, I think so Dr. Rachna will take it later. I'll introduce our next speaker, Dr. Renuka Alsi. Ma'am, you're there now?
Yeah, I'm there.
Hello.
Yeah, hi. Ma'am has already done the Masters in Reconstruction and Cosmetic Gynecology from London and American School of Cosmetic and a diploma in Urogynec. She's also done fellow in gynec endoscopy and fellow in sexual medicine as well. She's a chief consultant at Para Ella for her Center for Cosmetic Reconstruction. Also a sex educator, an intimacy coach, and a relationship counselor, and faculty at Art of Living, Bangalore. Welcome, ma'am. You can start with your presentation, please.
Yeah, thank you so much for that introduction. I'll start my screen right away.
Yeah, please.
Yes, ma'am.
Please share
Yeah.
it.
Okay. So is it visible?
It started sharing.
It started sharing. Yeah.
Yeah. Is it on the slideshow mode?
Yes,
Yes,
ma'am.
yes. It's
Yeah.
already there.
Yeah. So before I start for any of my lectures, I always make it little. I always like to put a light on why we are doing it. Why vaginal aesthetics is so important. Why the things are there. So I always call vagina to be a very sacred place, and I really have composed this for vagina. That vagina is a whisper of creation, a doorway to the life and a renewal, soft yet strong. It holds the power to heal, to feel, and to transform. The vagina is really far beyond the existence, is a symbol of creation, energy, transformation, and divinity.